don't think anybody in this day and age should have to spend days, weeks, months, even years sitting in a darkened room in front of a flickering television screen, smoking cigarettes and drinking coffee. I don't think that that is necessary for any person with a diagnosis of mental illness. We can do better. That's one reason I created CommonGround. Another reason I created CommonGround is because of people like my friend Lee, and I want you to have a chance to hear Lee talk to you.
Hi, my name is Lee. I have a mental illness. I've been diagnosed with schizoaffective bipolar type. Now I'd like to tell you my success I've had with CommonGround. CommonGround, this is the report of CommonGround that you're probably all familiar with. I suffered greatly at the age of 28. I broke with the illness and suffered greatly with medication side effects. The doctors would give me medication that was for the illness, but it was ineffective. I did not get an effective medicine, and so they just thought, okay, it's not effective, so we'll up it. So I suffered dramatically with more side effect. The side effect, this last I went to the hospital in 2004 where I received my miracle drug, and but it had a side effect, and again the doctors had it very high. The name of that side effect is akathisia. I was talking with Pat one day where I work, Pat Deegan, and she said, "Oh, akathisia." She said, "That's the worst side effect of all." And it was. I couldn't lay down. One day I spent 4 hours. I couldn't sit, I couldn't stand, and I couldn't lay down for more than a minute. And I would go to work, and I'd have to turn around and come right back home. And this went on for 6 months. Well, I don't know, quite 6 months. But I finally got in with my CommonGround report, and the doctor and nurse showed me the paper on akathisia, and I'm all, you know, I'm suffering. See, I'm suffering here. And they said, okay, we'll adjust your medication. And I had a great medication adjustment for a few months. After that, every once in a while, I would feel those side effects, but that has even dropped off. So now I am side effect free, and I would hope that for anybody that comes in, that they get the right medicine, and that they don't have the side effects. And the reason why I didn't speak up about side effects is because side effect medication has its own side effects. So for many years, I wouldn't speak up about it. When I did the CommonGround report, it gave me a voice. It helped me advocate for myself and tell the doctors, this isn't right, you know, look right here, this isn't working. And the great thing about this report is it stays there from month to month, and so if it's not working the next month, well, something's not right. So I'm really advocated for myself and hope that you can advocate for yourself. You don't have to live with horrible side effects. That's not recovery.
So for me, this video from Lee is a very powerful testament to so much of why I created CommonGround. And one of the things that really touches me in the video is the way she keeps pointing to the piece of paper. See, it says right here I'm suffering. See, it says right here that I am having a downward turn. And we saw that since day one when we were working with folks. There was something about this report the fact that people feel sometimes, I think, very, very small, and that in that 15-minute consultation, things can be very rough. Not rough, but rushed. Things can really be moving at such a fast pace that it's hard to get a word in edgewise. It's hard when you've got on top of your anxiety about seeing a doctor, which we all can experience. I think you can also, if you're also struggling with distorted thinking or anxiety or depression, it can be even that much harder to have your voice amplified and to be able to say what you mean and be heard. And that really was the big idea behind CommonGround, was to create an amplifier that would amplify the voice of the individual. Also, in the early days, as CommonGround was, as I was thinking about how can we get more and more people involved and to understand the good news of recovery, and I surveyed folks in the waiting area in a large mental health system and found that only about 20 to 30% of folks had ever heard of peer support or had any contact whatsoever with a local peer center or peer-run program. Mostly people's point of contact was that med clinic, and that docs and nurses in the med clinic were not reliable. They were not always sharing the good news of recovery with people. So part of my thinking in the creation of CommonGround was I wanted to create a point within the care system that with absolute reliability would say, hey, guess what? There is hope, and you can get better. And that point became the CommonGround software, as well as the peer staff, of course, who are helping people access it. I felt strongly that we needed to find a way to bring people's concerns to the center of the care team, because research consistently shows that what clinicians think people want to be working on is not necessarily what people want to be working on. There's very often and many times demonstrated a gap. And finally, the days of waiting in waiting rooms, nonchalantly thumbing through outdated magazines, frankly, in this healthcare environment are over. We've got to prepare to participate in our care. We need to become engaged, we need to become activated. And that in order to achieve that, we need to raise the bar. We need to say that our organization can only function when you as a mental health service user are fully engaged and activated in your care. Because treatment and care doesn't just happen in the office. The vast majority of treatment and care for long-term disorders happens in the context of our lives outside of the clinic. Why did I create CommonGround? Well, part of the reason that I created CommonGround is because, frankly, the status quo is not good enough. The status quo in behavioral health is not good enough. We have no-show rates of at least 30% plus across the nation. We have rampant polypharmacy. We have early mortality that has been well documented. We have people dying at younger ages than other Americans from preventable and treatable disorders. We have 50% plus non-adherence rate within standard practice as usual. And a recent study has just come out, and you see the citation here, showing that 5% of Medicaid beneficiaries are receiving evidence-based medicine plus side effect monitoring, screening, and psychosocial evidence-based practices. That means that 95% of folks are not receiving the array of services that we know and science tells us works. That's a frightening statistic. It just came out in 2012. We can do better than the status quo. So when people say, well, why should we do CommonGround? I like sometimes to ask, well, why do you do it the way you do it? Because this is the reality of what's happening in public sector mental health systems, and I think we can do better. And I think CommonGround is one of the things we can implement that will help us do better.